We have many different allergy diseases, the skin, the gut, the lungs. And that has been every year exponentially increasing. And then there were still, there are several hypotheses to explain. And not all of them will fully cover all the findings, but that means that by far, right now, probably the most common chronic inflammatory skin disease.
Hello, and welcome to the Pet Food Science Podcast brought to you by Wisenetics. I'm Jan Sogodolski. I'm dedicated to bringing you the latest insights and discussions in the pet food science industry. So get ready to expand your knowledge and stay ahead with today's episodes. It's my big honor to welcome Dr. Ramón Almela, who is a DVM, PhD, and a diplomat in the European College of Veterinary Dermatology, and currently an assistant professor at Tufts University. Hello, Ramón.
Hello, Jan. Thank you for the introduction.
Yeah, welcome. And today we're going to talk about dermatology and especially the use of obviously nutrition and then also about supplements and how they can really help, which ones are useful in the management, I would say, right? Because treatment is probably dermatology always a difficult part, but the management of some of the signs you see. So Ramón, I always like my guests to introduce themselves a little bit, or at least telling us the history. Where did you start? Where did your undergrad or veterinary school, and then how did you end up in the position where you are now?
Yeah, so I am originally from Spain. I studied there in the vet school in my hometown in Murcia, in the southeast by the Mediterranean Sea. So nice area. But then once I graduate, then I start to think about the professional future. And after doing different things, different fields, finally coming with dermatology, then came up with my passion. So I decided to follow it and then get deep training. So I pursue a residency training program, and that I found I was one of the candidates in a private hospital referral in the South Germany, in Augsburg near Munich. So I went there, I moved there, learned the German, so kind of speak with peers, with owners, and everything. And then after 4 years later, I finished successfully the residency, and then study for the boards, and pass the exam. And then after that, what they're thinking where will be the next step. Then I was already been in the state for several times, and we have very good experience in the university, and with we are very focused on academia and research. So we try to find positions, and then finally in the Northeast area, we re-elected at Tufts. Then we had a position for both of us because my wife is also veterinarian, radiologist. So the end we came here was back in 2019. So from that point on, we have been doing many things in more like research, teaching, and of course the clinical service with different research. I'm trying to also apply the different findings and the research. And yeah, this since 2019 we're doing there as assistant professor at India Clinical Science Department, small animal, doing dermatology.
Kemin Pet Food and Rendering is driven to deliver safe, high-quality ingredients that enhance pet food and help pets live their best lives. Every day, we provide specialized expertise, innovative solutions, and dedicated support across the value chain, from freshness and palatability to nutrition, health and well-being, and tailored services. At Kemin, we take science as seriously as cats take cat stuff. Expert insight, meticulous testing, and decades of research go into every ingredient we create, ensuring consistent quality and proven performance. Longer, fuller pet lives start with Kemin.
So when you talk about dermatology, obviously it's a very common problem, right? So what are the kind of main problems that you see, and what are the frustrating parts, and where can nutrition, and later when you talk about supplements, where you can really see a potential?
Yeah, so then with there is a fact that it's been happening since several decades, and it goes also along with in people, the problem in people, and that is the rise of the different allergic diseases. We have many different allergic diseases: the skin, the gut, the lungs. And that has been every year exponentially increasing. And then there were still, there are several hypotheses to explain. And not all of them will fully cover all the findings. But that means that by far, right now, probably the most common chronic inflammatory skin disease, probably will be the same in people as we have in our pets, but also we'll say that right now, not only affecting pets, also wildlife, zoo animals, and many other species with the allergy, with the skin allergy, atopic dermatitis, so they have different names, but basically the allergies represent by far the most common clinical scenario in our case log. And then there is a disease very frustrating. It can be frustrating for everyone, for the family, the guardians, the parents of the patient, the patient itself, and also the care providers. It's a very frustrating disease. It's very chronic. Not always every individual has different, let's say, responses to the treatments, a different manifestation of the disease. So at one point, there is a lot, or there is a lot of research in this disease because both the implications and the prevalence, the high number of affected patients. So again, this is a disease that is considered mainly to manage. So the true cure, that will be for another extent topic to discuss, but in general, is considered a disease to manage, and that's why it comes to place many different options and treatments besides the specific anti-allergic treatments that can help to ease the burden on the treatments, or even trying to improve, because not every treatment is perfect, and even doing the available treatments, not always it's helping in some patients. So that's kind of the question from the different other options. And by for one of the main ones, it's and has been, and it is right now ongoing, the supplements, dietary supplements, functional foods, many different options, trying to figure out if there is something that can be of help to either decrease the dosages or the amount of the treatments, but also trying to improve the overall severity of the disease, because it can be very severe. And we are seeing, and actually, I can tell you, practicing for many, many years, in personal experience, and probably have for discussion with other dermatologists, but that besides the rise in the numbers of the allergic or the affected patients, pets affecting with allergies, it's also that is more and more, it's getting more severe. We see more severe patients and more patient refractory to the standard treatments. So we know that in the pipeline, there will be for the next year some more available treatments, at least for dogs, but still any other help coming from any other treatment options is widely appreciated. And in this sense, it would come to question the different supplements. What I have seen for the supplement probably will be two different things in terms to approach the topic. One is what we feed, the facts, the evidence behind different interventions, and then what is happening in the let's say in the real world, in the social media for many families. And I have talked with many families all the time with allergic patients. And one of the things that that's why I trigger this topic to bring the topic to the podcast is that there are there is a huge amount of information about supplements to help with allergies, but there is also a lot of misinformation and also misleading some of the questions and the findings for these products. So many owners, they feel overwhelmed because there are so many choices that they don't know, and all of them they claim that are pretty good to control, and it's something even claiming with the owner, with the sound of the thing, like if you have not done it before, then don't blame yourself. You have still the options if you give these two, for instance. And usually this is two separate things, because at first for many I have been following many of these companies and the product themselves. And some of them it's true that some of them they are good quality and will make sense. But typically there is some misleading information because some of the claims are not backed up with evidence, or they're claiming something different as is we already know.
Let me just take a step back. I mean, so just maybe let's come to the evidence. So which supplements, or what is the treatment that we know works? Which supplements we have strong evidence that you think management, so that we kind of cover those areas?
So probably right now, the most evidence that we have is for the different antioxidants and the different, we have different definition, prebiotic, postbiotic, and probiotic. And there will be different definitions. We can discuss the definition, but basically has to do with the probiotics, postbiotics, and the antioxidant probably are the most research areas, and they have some more evidence compared to others.
But maybe one other step back. How about other ones like nutraceuticals, like omega-3 fatty acids and other ones? Is there evidence behind that, or is it in which category do they fall?
Yeah, so also probably with the polyunsaturated fatty acids, there is also some evidence behind them. It's true that it's getting overall, this getting more research to the different ones, because it has been assumed probably there is a tricky part with some of the treatment that has been already on the plate for many, many years, is that sometimes we assume because of the experience and we don't research much. This is some simple treatments, they are not really backed up with much evidence because they're so old, or they kind of like I'm already with such a good experience that they don't research on them. And probably it's still the case because it's already assumed for many different, specialties in terms of medicines, the benefit of the different polyunsaturated amino acids and fatty acids, that probably because of that has been ongoing research, although it's true that we already have some, and they can offer, still, they show that there's some evidence of benefit. Also, it depends, because in terms of the skin, there is a bit less information for this kind of supplement compared to other, like internal medicine or other aspects of the medicine. But yeah, you can include it as well.
But in those that have evidence, at least some evidence, what do you see as the biggest challenge? Why is the evidence not compelling? Is the evidence not compelling, or is it a variation?
Yes. So there are several factors. I agree with you that there are several factors that preclude more extensive research. And one of them is that by itself, probably the challenge to do to get to know with measurable, something to measure of benefits when you are doing something along with other treatments, usually as considered supplements or nutraceutical. They consider, let's say, adjuvants to this to other treatments. So sometimes the complex of the different treatments, the different regimes, and can be a confounding factor and be a challenge to truly get to know and to do like a randomized controlled trials compared with an open trial, which is much easier but offer less evidence. So yeah, that's probably one of the challenges.
And so what kind of other supplements are now advertised where you have the feeling that owners come to you, and what is your usual answer?
Yeah, so I answered that that if they are interested in a specific, let's say, supplement, then I will review what is the evidence, that see what is actually in this supplement, because sometimes there are many different things. And so first I will take a look on the different ingredients and try to look what we know, and besides experience and evidence from the specific supplements. In general, what I tell the owner is that some of these supplements we know that can help, but still there is, it's said that not allowed to be the only or the sole treatment if we have an allergic patient, with this one of the main indications. It's true that we do more, we recommend more all the different supplements and nutraceuticals when we have milder cases, because they might be more helpful. And you can also be it's more evident to get to know if there is an improvement in these cases. So I told the owner that first, to avoid something that could, let's say, impact the overall health or impact the medication, that's no treatment even considered nutraceutical. Sometimes we had to take a little bit be cautious, because not all of them will be totally harmless. Let's say an example. There was a case a few weeks ago in which similar with the owner was interested to do some supplement to see if that could help with the itch in the dog beside the other treatments. And as a prophet sent me the product, the link, I will take a look. So one of the problem with that product is that besides the fatty acid, that was one of the main claims, it also had in the list like liposoluble some vitamins, vitamin A, vitamin D. And we know that they're not totally enough. We have to take into account the dosages. There is like a maximum amount per day. They can affect some other organs. So it has, if it's very, let's say, innocuous, but not totally harmless. Let's say we have to take into account. So I provide the owner with a maximum, let's say, choose per day, calculating the dose according to the patient, to the dog. So at the end, sometimes can alter even other medications, some herbal products. So we have to consider one thing is to let the owners, the families know that Some of them might not be completely harmless. Let's say we have to take into account that being supplements in nutraceutical doesn't mean that are absolutely safe for any patient. So you want to take in the context from the patient, the disease, the problem, and what will make sense in that case.
So why where do owners get those supplements? They get them over the counter. Where's the marketplace where they obtain those supplements? And what can we do against it? So about the low evidence ones.
Most of the times, and I ask them to get to know what is happening in the and the situation right now. So most of them, they get in over the counter. So, and I was checking actually along with social media, and I check most of the advertisement. They're over the counter, and social media by far seems the main source for many things, including the marketing and the different supplements and nutraceutical available. And there is a lot of advertising on this product. I can check in even like for personal social media, and then every few seconds come out some advertisement regarding supplements in dogs with skin problems, let's say. Yeah, that's the main source.
What about the other side? Now we talked about atopic dermatitis, right? So it's a long-term management. I can see that a lot of owners are maybe desperate and looking for some additional treatments. What about in a healthy animal? What are kind of common supplements you see where owners say, okay, but you consider the animal pretty much healthy, but the owner still has some like shedding or hair loss or other things?
Yeah, that's also, and it's also a very common question from the owners. And in our field, probably most of the time the questions are related to the shedding. Probably hair shedding is one of the most common questions, and there is again many different, let's say, a lot of marketing regarding how to prevent the shedding and to improve the coat. So, for one hand, if we have a truly healthy animal, then probably if there is no other gap in terms of the nutrition, probably it doesn't need really any supplement. If we want any, let's say the owner want to improve the quality of the hair coat or glowness and in that aspect, then we can do specific recommendations, but not all the time they need supplement. For instance, for the coat, the quality of the coat is true that the fatty acids, for instance, play a big role here. And besides hydration and not using nothing that will damage the skin barrier, then those are some of the main things that we can recommend. In terms of the hair shedding, we typically explain to the families that is something physiologic. It's normal. It's like with other normal processes. So as long as there is no a true underlying problem of disease causing, for instance, like hair loss, evidence hair loss, but something the shedding is something that there are so many factors. It can include, beside the environmental factor, many hormonal factor, so many different factors from the animal, and also the animal that's different even to change, but actually that is something normal. It depends on the breed, time of the year, the house, in the temperature, humidity within the house, many different things. But at the end, that shouldn't can even be like normal. So we know we cannot prevent something normal, and actually could be harmful if we try to really stop. I remember sometimes for instance, in some bird owners when trying to induce some molts because of to have like a higher pitch singing in some of the birds. Actually, they were giving hormones, and actually that will cause problems for the patient in some time. So we had to act whenever there is a problem, and sometimes we don't have to create problems. Is actually it's one of the main things or main questions that we do with owners. They rely on us for asking what they should in terms of, is this a problem or is not? And they will openly ask. Have been like having this Oliver shedding a lot these past months, and so we still communication. Okay, how's overall doing? You have some picture, make sure that there is no skin problems. And sometimes we say like, oh, it's normal for Oliver just because it's a bigger. For right now, it's a bigger time to shed, but can be because we have two different type of hairs. In dogs, some of them, they shed seasonally, but some of them are permanently shedding the secondary hair. So that is the physiology and some normal processes. As in the moment that we had a problem is that we can intervene. And for the hair coat, typically the most common, and there's more evidence for that, the difference and fatty acid seems to be, beside the hydration, seems to be like a good supplements or good interventions in this sense.
So what are kind of supplements now as being sold for hair shedding that you think don't have evidence behind them?
Well, for instance, they are typically they use complex or different like multivitamins sometimes, like the B complex, but some again also including A and T, because the vitamin A can be tricky in terms that can have. I mean, it can be a treatment for specific diseases in for skin diseases in dogs. And by increasing the turnover in the epidermis and the process of conifications, they can have increase like actually like an improvement. It will be kind of a little bit artificial because that dog doesn't have a vitamin A responsive dermatitis just because of the trying to improve the quality of the hair coat. So probably the multivitamins are probably the most common that I have seen so far in most of these intended nutraceuticals. The same with the ones with the allergy, more into the antioxidant and the prep or probiotics.
But since we are also a pet food science podcast, let me ask a step back a little bit and say, how do you use foods? How do you navigate foods in your management of common skin problems? And maybe from time constraints, maybe dermatitis, atopic dermatitis, or you can choose which one is you think where food is the most important part of it.
So probably typically whenever there is a patient that could benefit from the nutrition-wise, we have also a discussion. We have a nutritionist on board, is most of the time available, so we can discuss specific cases and figure out according to the history of the patient. Sometimes they have different diseases and may have some, let's say, contraindication. You have a dog with, let's say, bladder stone, for instance, and other things. So in any case, we try to tailor to the patient and the needs. And if we need to, say if the owners are interested, for instance, sometimes the main interest is because try to do something to improve the this itch or the skin barrier, for instance. I usually with the owners we talk the different interventions. We can use supplements, we can use foods. Sometimes are very similar in terms of that supplement may have similar ingredients than the food. The only thing that is being easier in terms of like you don't have to eat the supplement, just the food. On the other hand, you need for those in those situations to be better storage in the food to prevent the loss of this antioxidant or oxidizing these fatty acids. But sometimes the supplements could be easier, or even different topical like shampooings, moisture foams, and many other that will also care for the skin barrier. So I present the portfolio. Every family is different. The context, the patient, the family will also determine which way for them will be more practical. And then unless there is specific from perspective from the dermatology medical part, usually we present the different ones, and then the owner will decide and ask if they have any further questions. In general, for us, besides cases of food allergy, if we don't have any food allergy, the main thing will be anything that could help in terms of the skin barrier. But I think right now is also the trend also in human dermatology, because more and more there is more evidence that this rise in the allergies has a lot to do with the skin barrier and its damage because of so many different environmental factors. So anything regarding for the skin barrier, I'm right now recommending many things, but at least something that we know that could help, like basically not damaging, no products that will damage, but also providing hydration, or that's something, for instance, the skin barrier. We know that the ceramides are like half of the content of the lipids in the epidermis. So anything that could have supplements in this sense with the ceramide, for instance, also could be helpful.
And those ceramides, just curious, are they as a supplement or in the diet, or are they locally topical?
So typically, ceramides can be most of the time topically, as a modified. As supplements, similar but also helpful will be the fatty acids. It's more easier to find them both topical and as supplements. But probably the ceramide seems to be better, let's say, delivered to the skin via the topical approach.
And another question, maybe like in human medicine, I know that there are topical shampoos that use probiotics. Do we have any experiences so far with topical probiotics for pets?
Right now, it's on research because there is right now a huge level of research regarding the topicals and also testing the different probiotics to use not only systemically, like will be with food supplements, but also topical. It's getting a lot of interest. Again, probably topically seems to be more relevant in most of the cases in people because in our patients, the thick coat prevents the use of many topicals besides shampooing only maybe in more the spare hair area, like would be the face, the feet, which otherwise are one of the most common affected areas. But probably that's one of the challenge or the factor that is not so research compared to people. But at the end, it will be similar, let's say, evidence in that some probiotics will be helpful for taking into account how the mechanism of the disease for the allergies and other chronic inflammatory skin diseases. Probably right now the main thing to address, and this is right now the efforts toward the research, is try to determine which strains are the actually one that could be helpful. There have so many probiotics, right? We have so many different strains, and we had to know first which one of those, at least for a specific, let's say we have an allergic dog. We want to help to decrease overall to spare some other anti-allergic treatments. So what strain or combination of strains, how often, what concentration, how number from the colony CFU, the colonies or the number of the different bacteria that will be in there. Those questions still remain uncovered and preclude like a strong recommendation. Probably we'll get there. And now in the last, in one of the latest Congress a couple of months ago, actually there were a couple of very good research on this in terms of which like strains of probiotic that could effectively be helping in allergic dogs. It still is not widely available, it's commercialized, but it will be and probably will extend. And they have been very back at the evidence. It was a product from Korea, for instance, and there's another from Australia. Probably they will get more, and they are doing a specific, and that's it. How I would like the companies to do, and this one are doing that. Let's say we want to do like let's say nutraceutical supplement for some specific condition. Let's find our product at the same time that we're developing our product. Let's back up, and all the companies do that with some researchers, some dermatologists, to have some evidence, real life evidence for that, and they can offer. And actually, see the website or the information of the company. And it's true that some of these companies, they already have the information and the references that you can go and then read the papers with the study that they have done. And then that is something that I like because I can rely more and actually nothing mysterious. Sometimes when I go to some of these companies on the internet, I find that it's not really something very clear what's in it, what they have, and nothing. It sounds like very mystery or like a smoke thing. But these other companies very clear. You can go out and the website and you have all the reference, all the data, and then you can choose. That probably will, in this sense, this kind of research and this kind of this company probably will get to a point to more useful intervention of supplements because of that. So that's one of the things that I also take into account.
Great. So we're kind of at the end of our time. Let me ask you a little bit outside the box question. And so we are always like questions about. So you're a super excited dermatologist. So let me ask you a question. What actually in veterinary medicine? What is your favorite book outside of dermatology?
Also, pues definitely. So I remember, and this has a huge impact when I was a teenager. That was this. How does it will say the it was the book. I think for Farrell was the author, and was basically how to speak with animal. They would say like let's say like the in this kind of like animal whisperer. Let's say the communication that fascinated me, and I have read the book many times. I mean, it's actually in terms of like this, not really that book at the end goes more how to interpret the different how the animal use different communication, all different kinds. But it was so fascinating for me how to connect. And as I do really like the communication in general for animals and people, that probably is one of my favorite books outside the veterinary field.
Okay, that's great.
Farrell, exactly. That was the author.
Okay, wonderful. Thank you so much. So I really enjoyed about talking about all, because dermatology, I think, is a tough area, right, to deal with with these chronic diseases. So that concludes another episode of the Pet Food Science Podcast, brought to you by Wisenetics. Thank you for joining us today. Don't forget to subscribe to our podcast to stay updated on future episodes. And if you enjoyed this episode, please leave us a review. Your feedback is very invaluable to us. Until next time, this is Jan Sokodolski from the Pet Food Science Podcast, signing off.